let me move this discussion forward a little bit. These are the tests we're using to move people from smoldering to more active myeloma are relatively old-fashioned, let's call them that, you know, M spikes, and we're entering this new era of genomic medicine. Dr. Jagannath, what do you think the future looks like for defining myeloma and myeloma risk, gene expression profiling, for example? Is there a role for that here?
I think the future of the medicine is that there will be definitely role for them. Right now, you know, there are two aspects to this. Right now, using FISH and cytogenetics, now gene expression profiling gives you a lot more information than FISH and cytogenetics, but they are all only useful prognostically, because even when the information is given, if it is high risk versus low risk, whether the tailoring therapy matters, that's where the whole question comes, which later on will be addressed, whether we will use doublets and triplets and things like that. But yes, this is important, but it is only prognostic, and it does not help us necessarily, you know, how to manage the high-risk patient is not that clear. We may want to treat them more aggressively with the same agent, but the future is, as new medicine comes, like antibodies and others, this will become even more important.
Jim, do you foresee using gene expression, or do you do it already, or where do you think genomics is going with this?
We don't routinely do it. We've actually recently identified a new solubilized receptor called BCMA. We've shown it's highly prognostic, can also be used to monitor disease, and you can also put patients in high risk simply on a serum blood test.
But that's not yet available for the
not available yet.
Oncologists we're talking to.
Not yet. Hopefully in about a year.
Right. I mean, guys, do you see next generation sequencing becoming part of our diagnostic arsenal?
I think we're going to use all of these techniques eventually, but right now there's no, I think some of these techniques we don't have standardized approaches, and in other cases we don't have any sort of consensus on how to use them. I mean, to go back to the question of gene expression profiling, the one way that I use it in my practice is I have clinical trials for high-risk patients and standard-risk patients. And so I use that testing. If other factors don't help me distinguish which group a patient falls into, I'll use gene expression profiling. But other than that,
So if you're a doctor in the community watching this, would you recommend that they start doing gene expression, or is it not, it's too early?
To be honest, I don't recommend that it's used in a standard.
Dr. Lonial?
Yeah, I mean, I think we get, it gives you more information. What to do with that information as compared to a good FISH panel and cytogenetics, I think is still in development.